if you go to, for example, I remember a lecture I went to, medical lecture, where the speaker was telling the audience, which is all doctors, never ever suppress the TSH. Not allowed. Never do that. And why not? Well, because there are adverse side effects. Number one, causes osteoporosis, and the so what is that really true?
Yeah.
We know that in Graves' disease, thyroid hormone levels are very high, and that will be associated with loss of calcium from the bones and eventual osteoporosis. However, TSH suppression from thyroid medicine, as long as the thyroid hormone levels, T3 and T4, are in the normal range, the patient is not hyperthyroid, and studies have been done showing no, there's no osteoporosis in those TSH suppression uh, without increase in thyroid hormone levels. So the the other thing to think about is mainstream endocrinologists will suppress the TSH very commonly in a patient group that has had thyroidectomies for thyroid cancer, and this is a very large population of people now. They will suppress TSH below the reference range, and it's thought to as a treatment to prevent recurrence of cancer. So we have a huge population of those people with suppressed TSH. They give them thyroid medication to suppress the TSH. Mostly, endocrinologists will use levothyroxine. But yeah, the TSH is suppressed below the reference range. And that population has been studied. There are numerous publications studying that population. And there are no adverse side effects. There's no reduction. There's no problem with bone density. There are no other adverse side effects.
They're not
Now,
hyper, because that's what a lot of people are being told. Oh, if it's too low, you will be hyper, you'll have heart palpitations, anxiety, extreme weight loss, which a lot of people would welcome. But that's what
no,
they're
no,
being told.
no. The thyroid hormone levels are maintained in the normal range. So, but by no stretch of the imagination can these people be hyperthyroid. They're